years. I work very closely with vets while I do my work, and I've seen some very, very interesting changes occur. I've worked with minis, I've worked with quarter horses, I've worked with horses that were 17 and 18 hands high. What you will see today is the changes that occurred in Bodhi, a 16-year-old quarter horse. He came up lame on the left side, and I think you'll find it quite interesting that these changes occurred just during one session. Hello, I'd like you to meet Bodhi and Tom. Tom's been around horses most of his life. Would you like to talk about that and introduce yourself, Tom?
Well, I was actually raised on a ranch in Montana. I moved here when I retired, and so I volunteer for an organization called Heart's Adaptive Riding, and that teaches special needs folk horseback riding. And Bodhi was one of their horses, and he came up lame. So I'm in the rehab business with Bodhi. He's mine. Now we're working on him. I met Gloria, and she's giving him a treatment or two, and I think we made some progress. And so we're out here today to not only talk about him, but to talk about her.
Thank you. So I've made an assessment, and I've been working on Bodhi for about 5 minutes. The first thing I'd like you to notice is how Bodhi is getting relaxed. You see, he's getting awfully relaxed. The eyes are closing, closing, closing. There you go. And I've already walked around his body, and what I found, in addition to a little puffiness on this side, there's a high side on the right rump. And the lameness is on the left side. Very frequently, there's a connection between the left and the right side, and it's what I call the transverse effect. Well, Bodhi seems to be taking this in. He's relaxing quite a bit. I've been working on Bodhi for about 5 minutes, and I did adjust the rear right rump, and this seems to be a little more balanced here. So what we're going to do now is just walk him. Oops. So it's the turning that gets him. He's unsteady. Okay. So it looks like there's a drop of improvement there. So that was a little bit of an improvement. What caught my eye now is the chest. So I want to try to strengthen in here. This is an area that frequently collapses with all kinds of issues. So I'm just going to try to tighten this up here and help Bodhi to lift here, and then when he does his turns, we'll see how effective that was. So Bodhi's getting a little more energy here. So fine. So there's a very interesting thing that's going on now. My hand is actually vibrating. This very seldom happens. Is being positively affected in here. Woo. Okay, baby, let's see what that looks like. He's not as tentative. He's not as tentative. That was a better one, Tom.
And if he stands up on all 4 feet, that's a positive for me, because it either hurts less that he's willing to do that or not. So that's what I noticed rather than anything else.
Okay.
And I noticed that he moved after a few minutes. He did move all square again. So
I'm going to give that another pass, and then we'll do a test run.
When Gloria first talked to me about it, I thought, yeah, right. But you get there, and then you see the results, and you buy in a little bit more.
Sure.
But
yeah.
I mentioned it to a couple of other folks, and their eyeballs rolled clear into the back of their head.
I totally understand.
As if you got to be kidding.
Yes.
But when you're trying to rehab them, you do what you do. In other words, whatever chance you can find, whatever shot you can take, you take it.
Right.
And so that's it.
Whoa. Well, Tom, on the straightaway, it looks quite different. Does it feel different to you?
Right now, yeah, after I told him that I'm tired of his smart ground.
Look at that.
He says, Dad, I guess every now and then you got to tell Junior to shape up or ship out. What do you think, bud? What do you think there, square foot?
I'm pleased with what we were able to do today. So it looks like the lameness is a little better. Whether that's Tom's doing with his encouragement to get with the program or the energy, we may never know, but definitely saw improvement today. So thank you, Tom, and thank you, Bodhi.
You're more than welcome. Bodhi thanks you, and so do I. Well, they found out I used to be an auctioneer, so I'm trapped once again. So here we go. You able to buy them at 100, now but a quarter, now but a half, would have been 100 and a half, would have been a 75, and now but 200, 2 and a quarter now. Half 75, put them at 75, would have been a 300 and a quarter, now but a half. Sold them 350, 375. That's all you're going to get out of me today.
Well, you've seen what I do. The energy does the work. You can call it magic, you can call it science, you can call it just some good luck, whatever. We know it works. So I invite you to keep an open mind. Anyone who walks through my door is welcome to treatment. Thank you.